happy to see that the AARP lost 60,000 members last year. Way to go! You know, the AARP is an insurance company. Well, you got to buy their product too. They've got an unholy alliance with United Healthcare to sell their Medicare Advantage programs and their supplemental insurance. They don't really need you as a member once you have to buy their product. So keep the pressure on the AARP. So, you know, it's funny, Obama and Congress feared that this would happen. They just didn't know we were ready to spring into action. They feared that freedom-loving Americans like you would stand up because they know they can't sell their plan to people with half a brain. And they know why, because Obama gets up there and he says, oh, don't worry, there will be private competition. Just look at FedEx, just look at UPS. I mean, they compete against the post office. Oh, I shouldn't have said that in public.
It wasn't on the teleprompter.
So, if you want to go postal, you can go with Obamacare. And if you want the efficiency of the DMV, and I saw this on a sign, and the compassion of the IRS, well, you can go with Obamacare. If you want a plan that's going to bankrupt our country more quickly than we're already getting bankrupt, then go with Obamacare. And for goodness sakes, don't get all wee-weed up about it. Just kind of sit there and take it. And you don't have to worry because, you know, they kind of released it last Friday night at about 5:30 p.m. Their projected extra deficit spending, not the current 11.7 trillion deficit we had when I checked a few hours ago. It's probably up higher than that now. It was only going to be $7 trillion over the next 10 years or so. Well, it's up another $2 trillion, as Dr. Evil would say. We're up to $9 trillion. We're doubling our deficit. Every child in this room should be running for their lives. And thank you for having the families come out and tell Congress not to ruin their futures. Into gas and how they can control the weather 50 years from now when they can't even get a cash for clunkers program to last more than a few weeks. This is a government that is going to tell me when to do brain surgery? For God's sakes! And Obama likes to say, well, folks like us are just a bunch of fear-mongers using scare tactics. Well, let's talk about scare tactics. There are 47 million uninsured. Well, we already know 10 million are not Americans, 16 million are greater than 50,000. They can't find an affordable health insurance product to buy in the status quo system. He says 60% of Americans have medical bankruptcies when in fact UC Davis has shown it's less than 5%, and the Harvard study he quotes was widely discredited. He likes to say, the economy will be destroyed if we don't act now. Well, he's doing a pretty good job with unemployment, isn't he? You go, Mr. Obama, you go. He likes to say that we spend twice the amount in America than we do in other countries. Well, that's because we don't ration our health care. Gee, why do we spend more on patients? Because there's not a government panel saying you can't spend over X dollars like in Britain, where if you have breast cancer and you want the drug Herceptin that will save your life, if it costs more than $45,000 for the bureaucratic term quality adjusted life year, QALYs, you don't get it. That's why they spend less on health care. So I have this message again for Mr. Obama supporters. Do not be fooled. You will be forced to buy insurance from health insurance companies you hate. They will have endless profits. They should come to us and say, here's a cheaper product you want to buy. They should have the Geico lizard on TV saying, wouldn't you like my health insurance? It's cheaper and better. That's American competition for you. And Mr. Obama supporters who say, well, I'm thin, I'm healthy, I'm a vegetarian, I drive a Prius, you know, I don't really need a lot of health care. Too bad. You got to pay the same amount of a smoking person who has diabetes and who is overweight and has been in the hospital 5 times, because that's the tax we are going to impose on you. Don't be fooled. This individual insurance mandate will be the same as a tax. Now, what's great about the illegal immigration amendments, there's also the abortion amendment that says that they had an amendment that said no federal tax dollars for abortion. Well, they killed that. They like to go around saying we're spreading lies. But they will raise taxes. We heard about the 2.5% penalty. They cap and trade. They tax your very air you breathe, practically cigarettes, soda, increased costs on health insurance. In fact, they're going to tax the Cadillac insurance plans. Of course, they won't tax their own health insurance plans. They're going to get the same plan they get. They won't take the plan they force on you. When you have this bureaucracy, there's scientists floating around, and they say, well, we'll take the public option out. Well, that was a bait and switch plan for many years, folks, I'm sorry to tell you. Keep fighting the public option, but the real bait and switch is individual mandate. This diagram will look not one iota different. It'll be the same rationing panels and maze of bureaucracy. Now, I'm almost done. There are better solutions. They are real American solutions based in freedom, capitalism, and individual responsibility. They mean you get individual tax breaks. Wouldn't you like a tax break to buy your health insurance outside of work? If you can get cheaper, good health insurance in Utah, wouldn't you like the right to do that? That's right. If you could put money in your own pocket through a health savings account, tax-free, and take it out of the insurance companies, wouldn't you like that? There's no doubt about it. But just look at how Medicaid helps the poor now. There are poor people who've driven from the panhandle of our state to my town in St. Petersburg because they can't find a neurosurgeon who will take 53% of Medicare to see them. Do you think the poor are getting served well by our government now? So here's how you help the poor. Have you ever heard of a thing called charity? You ever heard of the Shriners Hospital for crippled children? Helping burn victims and scoliosis patients and people with leg deformities. It all comes out of private money, but wait, we're going to tax those private charities, so when you donate to them, you can't help them, and the only place you'll get help if you're poor is a government that wants to deny you care. And I ask you to go to doctorsforpatientfreedom.com. Ask you to go to NCPA, National Centers for Policy Analysis, ncpa.org, and you can see some of these market-based solutions that they just don't want to think about because they really change the status quo. Now, I'm just going to close with a thank you again, and you all need to keep the pressure on. You're going to keep fighting. You need to keep going to the town hall meetings, and you need to keep fighting for freedom. Leaders among you who organize these things to get 3 to 5 people in a quiet group without a protest and make an appointment with your local congressman and sit down there calmly and say, we just like 20 minutes to sit down and see what they say. See if they'll sit down. Then you can walk outside and have a press conference. That's called lobbying. You can do it for free. You don't have to be paid to lobby. And you need to put the pressure on the Republican Party because they are going to sign off on this mandate. It's the Republican Party that blew it and got us to where we are today. And we need to take them over, freedom-loving people, and remember that they used to stand for small government. They used to stand for individual freedom. And if they don't stand up again, they're going to go away forever. Solowinski's rule number 12 to isolate someone from their friends. Each and every one of you needs to come to their aid, like to Glenn Beck, like to the Whole Food guy, like to Katie Abrams, and I thank you for coming to my aid when I was attacked by those radicals as well. And I just want you to say this with me. No public option.